Bhutan, although small and landlocked, is situated at a critical crossroads connecting South Asia, East Asia, and Southeast Asia. Over the past 5 years, these regions have experienced numerous outbreaks of African swine fever. With more than 60% of the population dependent on agriculture, livestock plays a vital role in Bhutan's economy, contributing approximately 5% to the national GDP in 2021. In this context, the public sector provides free animal health services, reflecting the royal government's long-standing commitment to supporting rural communities. Pig farming is an expanding industry, ranging from small backyard operations to semi-commercial and commercial farms. However, biosecurity measures have historically been limited, especially in backyard farms. ASF presents a significant threat to the livelihoods and food security of approximately 421 million farmers in the region. Bhutan has also faced ASF outbreaks, which have led to detrimental economic effects on farmers. Although ASF does not pose a direct risk to human health, it can devastate pig populations and the livelihoods that depend on them. The disease was first identified in Bhutan in May 2021 near the border with India, and since then, ASF outbreaks have affected several southern districts, putting smallholder farmers at considerable risk.
Pamsin 해망하지 않는 중기 비발라 중기 아직 중국지 않는 진디디 때 안을 술에 같이 안에 들어 bomb 속에 때 술에 들어 안에 bomb 안에 진 안에 그치로 중기 안에 베베 들어 안에 지소이 때 같이 안에 베베 들어 술에 안에 그치로 네 안에 네지디 토베디 미틀라 델레데 프로 로스 야세들라 팜 안에 그치로 고노자 안에 송베 때 안에 가라나 tingati complain submission complain de pa ana ya gele ana le chamna bala tingati na gara ne phobes na dorona le ani gosu te sini ngati de semkhati noi ya ge chamche mes noi ba te sulibe de ngati na gosu tingati pa gonor no complain be te gonor ge pha begolo te timbunan begolo te timbunan asabang na loi te sabang na ko be dele kon se ge gara sila
The ASF Preparedness and Response Project was initiated to strengthen the animal health sector in pig rearing areas in the southern region. This involved building local capacities, improving detection and response, and establishing better communication and biosecurity practices. The project's end goal is to preserve the livelihoods and food security of the people of Bhutan amidst the threats of ASF. This project can best be understood by looking at the entire journey as a roadmap. Our end destination is the desired impact. The livelihood and food security of the people of Bhutan are preserved amidst the threats of ASF. The path to this impact involves reducing the risks and impacts of ASF on food security and livelihoods through improved animal health capacities in prevention, detection, and response. Several outputs contribute to this outcome. Each output addresses critical areas in ASF control. Let's break them down. Output 1. Enhanced coordination for ASF outbreak response, including improved risk communication. This involved updating the National ASF Prevention and Control Plan, developing a risk communication plan, and raising awareness using materials translated into local languages. Output 2. Improved capacity to detect and respond to ASF outbreak. Regular proficiency testing programs in laboratories, equipping regional laboratories with PCR facilities, conducting training sessions and field simulations, and providing guidance on assessing the socio-economic impact of ASF were key activities. Output 3. Enhanced biosecurity practices along the pig value chain. This included assessing high risks, formulating mitigation strategies, training animal health workers, sensitizing import control measures at border points, and conducting a study on biosecurity interventions at the farmer level.
중기배, 바프라배, 대 동할레 만듭도배 다 고아다시 숨숨도일. 아니 비가치기 다 공기 숨 가서 문제라. 다 지금 리트디비라 라인 도시들라. 대 나나 가서고 대 추가래 나가 때라고 대 나나 피가 나나 지금 미온 줄 민라. 이미 같이 인문 아니라 te ma labiru dengan macam tibi tu sudah.
These steps have laid a solid foundation. Through this project, we could minimize the risk, especially in terms of building the capacity of technical people in our country.
We have been also able to review and update our control plan on ASF, as well as develop risk communication strategy, which is the first of its kind for any animal diseases.
So FAO has been a critical technical partner to the Royal Government of Bhutan for strengthening capacities on animal disease management and animal health systems. Recently, we had the pleasure of partnering with the National Center for Animal Health for a project aimed at supporting the government to better detect, control, and manage African swine fever. We also have excellent partnership with the Department of Livestock and also agencies such as National Center for Animal Health on the implementation of the Pandemic Fund project, which FAO is supporting relevant animal and human health and One Health partners to strengthen preparedness for potential pandemic diseases.
These perspectives show us how the ASF project has mitigated immediate risks and built a foundation for ongoing vigilance. With stronger animal health capacities, Bhutan stands better prepared to face ASF and future threats, ensuring that livelihoods, food security, and the resilience of rural communities remain safeguarded.